Hi, my name is Alexandra Rolls, and today I'm going to review the procedures for extubating a patient. First, I would check the charts to see if it's indicated for this patient, and in this case it is. So for the next step, I would inform a nurse on the fact that we are coming in to extubate the patient. So I'll need to gather the materials needed. In this case, we'll have suction with a yank arm. And then we have a nasal cannula, which is attached to oxygen, and we'll also collect a towel to place on the patient. As we enter the room, we will put on our gloves and introduce ourselves. Hi, my name is Alex, and I'm from respiratory. We'll inform the patient on what we plan on doing for today. In this case, it's extubating him, so we're going to say, hey sir, we're going to get that tube out of your mouth, and it'll only take a few minutes. So, for starters, we're going to listen to his breath sounds, check the vitals, and his general appearance. Okay? So now we're going to get ready to actually do the extubation. I'll start by hyperoxygenating him. And as that's happening, I'm going to place this down. And as you can see, he is in Fowler's position, which it's not technically Fowler's, this is more semi-Fowler's, but if we were actually doing this, he'd be sitting up. Okay, so now he's hyperoxygenated, and I can tell that he's indicated for suctioning. So I'm going to do an inline suction just to get the secretions out first. So here we go. You're going to feel a big cough coming up. Suction, suction. Okay, good. Okay. And then now we're going to grab the yank arm from this section, okay, and get any leftover secretions that still might be in there. Okay, so now that we've done that, we're going to do a quick little test to see if air can actually escape. So we're going to ease up on the balloon, or else we're going to ease up on the syringe and listen to see if we feel or hear any air coming through. And in this case, it's all good. We're going to reinflate the cuff of the ET tube, and we'll prepare to extubate. So I'm going to start to remove the Hollister securing device. And then we'll remove the stickers from his face. Just to make sure, again, we're going to hyperoxygenate again, just in case if it stopped. Okay, so we're going to instruct the patient to take a deep breath in and then to cough. So take a deep breath in, now cough for me, and while he's coughing, we're going to draw back on the syringe, totally deflate the balloon. And then we're going to pull out. Oh boy. Fast. This would be much faster if it were a real patient. Okay. Pull that out, place it down. Put them on oxygen again. So nasal cannula is going on. Okay. And we're gonna, while he's still coughing, we're going to get any more secretions that are left up that he's hacking up. Place this to the side, dispose of the tubing, and afterwards we are going to auscultate, make sure he's doing okay, so check breath sounds, his vitals, and general appearance. Check breath sounds, vitals. We'll listen to the tracheal sounds for any signs of stridor. We will also go back to the computers and note how they tolerated this treatment, and we could also suggest other airway clearance devices. And we'll chart it. Let's see. I have to make sure everything's in. Okay, let's see. At this point, I should have
Inform the nurse on how the patient tolerated the extubation procedure.
I think that's it. Patient's oxygenating. I think we're good. And voila, that concludes our brief presentation on extubating patients. That's all, folks.